Hello. Can you hear me?
Yes.
Okay, great. Hey, everything's working on my end. Doesn't always happen, but we'll take it.
Declare victory.
There you go. Hello, everyone. Lisa, I see you started recording. Lisa, are you here? Well, I know you're here.
Yeah, I'm here. I've been thumbsing up.
Okay. And you've started the recording?
Yes, the recording has started.
Okay, great. Let's go ahead and call the meeting to order. It is 3:01 p.m. and we'll do a roll call. Valerie Richards has an excused absence today, so she's not here. Linda Winstanley. Yep, I see you here. Or no, that's Linda Whitney. I don't see Linda Winstanley yet. Julia.
I'm here. And
Okay.
Linda's in another country. I don't know if she's going to be here or not, but she is in another country.
Oh, well, that's probably not going to work then. Okay. Grant, I see you're here. Grant North.
Yep. Can you hear me?
Yep, there you go. Linda Whitney.
Thank you.
Linda Whitney. I see her here. Miranda Robinson is, no, Miranda.
I'm here.
Okay. Kristen Bergathon contacted me. She has an excused absence as well today. Amber.
I'm present and accounted for.
Okay. And Seamus.
I'm here.
Okay, so we do have a quorum. And let's see, hold on a second here. 1, 2, 3. Yeah, okay.
Randy, this is Linda. Did you mark me here? My speaker was off.
Linda Whitney, yes, I marked you here, yes.
Thank you.
Yep, you bet. Okay, let's go on. Commissioner Thompson is here. Commissioner Thompson?
Yes, sir. I'm here.
Okay, is Jill here? Don't see her.
I am here.
Oh, you are.
Yep.
Oh,
I'm
there you are.
going to be kind of in the background today, though, so not feeling 100%.
Okay, thank you.
Yep.
Hope you feel better. Lisa's here. Monica is gone, I believe, this week.
I'm here.
Oh, you're here.
I'm
I thought
here.
you were gone. Okay.
No, that's July.
Oh, that's right. Okay. Shira's not here today. In place of her, Amanda's gonna give her fill in for Shira today.
Here.
Lori Moore.
Shira
Are
is
you
here.
What?
Shira is here too, but Amanda
Oh.
will present for her.
Okay, Shira's here too. Okay, well. Okay, Lori Moore, are you here? I don't see Lori. Okay, let's move on then. We have a guest that is listening in on our monthly meetings here, and her name is Christy. So she has been joining us recently. Let's go on to approval of agenda and the minutes. So the agenda for this month, I do have one correction I want to make on this that I just noticed. And under Grant North, it says he is an ex officio. He is not. He is a member. So I would like to strike that off of there. And
Noted.
okay, any other changes or comments on the agenda? If not, then I will take a motion to approve with the noted change.
I motion to approve the agenda with the change.
Okay, second.
I'll second it.
All right, motion has, or all in favor, excuse me, all in favor?
Aye.
Hi.
Opposed? Opposed? Okay, motion has carried to approve the agenda with the noted change. Has everybody had a chance to look at the minutes from May 1? If so, does anybody have any changes or comments they'd like to make on the May 1 minutes? Okay, if not, I need a motion to approve the minutes as is.
I make a motion
make
to
that motion.
approve the May minutes as is.
Second,
I'll second it.
okay, all in favor?
Aye.
Aye.
Hi.
Opposed? All right, the minutes approval has carried. Public comment, we don't have any guest comments today, so we'll move on to presentations and access to services. Amanda Donovan from CBH. Amanda, you have the floor
Hello.
for 10 minutes or so.
Yeah, can someone share or provide me the ability to share?
Yeah, let me figure out how to do that.
I got it, Lisa.
Anna
jumps in.
We probably both did it at the same time. You're double presenter now.
Okay. Well, hello, everyone. So I am going to present to you on accessing outpatient services at CBH. And these are pathways in which individuals can access services. We won't be referring to any like provider referrals today. All right. So I thought we'd start with a program overview. Just a reminder of what our core programs are. So we have mental health services, crisis system services, recovery services, developmental disability services, community-based services, and housing services. So access points. We have actually 12. For some reason I typed 13, but it's actually 12 access points. So the first is our online enrollment packet, and then we move on to actually calling and speaking to an engagement specialist, and we'll go over these in just a second. Dropping into our rapid access clinic, mobile services can refer individuals that they have interacted with through their work. We have Recovery Ally Outreach. The Clatsop County Jail is an access point. Our CBH shelter and supported housing are access points. Civil commitment, which we won't really touch on much. Civil commitment is part of a presentation that will be provided to you guys at a later date. I believe it's next month. And then school-based services, the emergency department, the deflection program, and treatment court. So access points 1 through 4, and I am more than happy to send these to you, or to send this out to you guys. So we do have documents online that they're enrollment packets that are through DocuSign. Individuals can get online, fill out a packet if they are able to. That packet is available in both English and Spanish. And it gets the ball rolling. So I put the pathway on this. So the client, submits their packet online, and then our engagement team contacts them, or someone from our engagement team contacts them. It's important to note, though, that the engagement team will call individuals 3 times, and after that, they don't call anymore. So they do note that in the chart that they start for the individual. So at that point, the client or the potential client would need to contact us. So the second is calling the engagement specialist. This one is only slightly different from the one before in that to get the ball rolling, the client is actually calling into our main number and speaking to an engagement specialist right then and there, and they receive the paperwork to complete after they're scheduled for an assessment. So the Rapid Access Clinic, this is a very helpful pathway, especially for individuals that are lower income or may not be insured. So the Rapid Access Clinic is located inside our Bond Street office, and that is the old Social Security office. So they are open Monday through Friday. They start doing assessments at 9 a.m. The last assessment starts at 3 p.m. And then how that would work for the client is they arrive at the Rapid Access Clinic. They don't need an appointment. It's okay to be uninsured. And they will complete minimal intake documents. We've gone over the documents for that clinic so that it's the lowest barrier for clients through that pathway. They will meet with an engagement specialist who does a brief intake. They can refer them to other services in the community also at that time. So if they have like needs for food, or maybe they need to be connected with Voc Rehab or the supported employment specialist within CBH, the engagement specialist can get them that information. So then they go through a assessment, and the client is scheduled for ongoing services if they desire to continue seeking services with us. So Amber, you asked what would happen if they came in between 3 and 5. It really depends on what the urgency is. So if it's a crisis, we're going to have staff there that can engage with them. If it's not like an urgent need, then we will put them at the top of the list for the next day.
Can you hear me?
No. Now we can.
Can you hear me now?
Yeah.
Okay. Just a quick clarification. We actually just expanded our rapid access 5.
Oh, your sound went out again.
If you come in at 4:30, you may not get a full assessment, but you will at least have a conversation with someone who can then make a plan for your return. So when we first opened these clinics, we did it until 3 because we wanted to make sure that folks didn't come in and then they didn't get seen. And we also needed to build in some clinical documentation time. But we just extended those hours, Amanda. So I apologize for changing it on your current presentation.
No, that's all right. We also are expanding rapid access to South County. So we currently are providing SUD services at our Seaside Clinic that are drop-in, and we will be expanding into mental health services, in a month or 2 months? Okay.
Yes, in August.
Will that be in the same location, the same building, or a new building?
Yes, it'll be in the building, the current building.
Okay.
So the other pathway out of the top 4 is mobile crisis. So when there is a need in the community, when there's a mental health or crisis, or mental health or substance use crisis in the community, that individual can call our crisis line, and they can speak to someone from Lines for Life, that is who mans the crisis line. If Lines for Life deems it appropriate to enact mobile crisis, we will, or they will call our mobile crisis team. The mobile crisis team will arrive within a 2-hour window, and that really depends on whether or not they're currently seeing a client and where they're coming from. So if the need is in the in North County and the individuals in South County, then it may take a little time to get there. Not much, but a little. So the mobile crisis clinician will do a crisis assessment, brief intervention and counseling. They'll safety plan with the individual, and then they'll connect the person to ongoing supports and services, and that includes outpatient services. So when mobile crisis sends information on that client over to our engagement team, if they're a new client, then the engagement team will call them, like I said, 3 attempts to engage them in services. If the person in crisis is a current client, then their clinician will follow up. So a few things about medication management. So medication management is under our mental health services. It's one branch, one of the 3 branches under mental health services. Med management has a few more requirements than some of the other services. So a mental health assessment is required to engage in psych services. The preference is that the individual receive 3 months of mental health counseling. The purpose of that is to ensure that we are providing as many modalities as we can to help that individual through what they're going through, and to rule out what any other pathways that that individual can take before we start prescribing medications that affect the brain. Now, SBMI clients, which is serious and persistent mental illness, they are fast-tracked if that is clinically indicated, so that those individuals who are more acute, as far as the population of clients we treat go, don't have to wait. So we do need records from all treatment facilities and providers so that our prescribers can make the best, most informed decision with the client. And refills, people get a little confused about the refill process. So we do have paperwork specifically on the refill process and medication, and we go over that with clients, but they need to attend their appointments. So if a client's sick and they miss an appointment here or there, that's totally understandable. Like, things happen in life, right? But if the client is on a 90-day prescription and they miss every appointment for 3 months, then that's another issue. So the prescribers will be very reluctant and probably will not, in most cases, provide refills until the client is seen. And then we do have one-time consults available for providers or for individuals. Their current provider would need to request that. The address for our Seaside location, which I believe was in the comments, I can grab that for you. One second here. Okay. The Seaside office, I used to have these memorized, but we have too many offices now. The Seaside office is 1005 Broadway Street. It is right across the street from Chamber of Commerce and right behind City Hall, like right next door to the fire department. So I thought also it would be beneficial to discuss what's urgent and what's a crisis.
Amanda?
Yeah.
Amber had a question for you too as well.
Oh, okay.
Amber, you want to go ahead and ask her?
Yeah, I was just curious with the mobile crisis protocol. Does it look differently when the mobile crisis clinician that's like embedded with the police department, when they respond to a call with the police officer? Does the process still look the same, or is there a difference with that?
I have not heard that there's a difference with that. I would imagine that that's the same. They're still going to outreach to our engagement specialist or the current clinician so that we can try to engage that individual in services.
Okay, perfect. Thank you.
So a mental health crisis is a situation where an individual is a danger to themselves or others or cannot care for themselves. And that is a situation where the crisis line would be really helpful. We still will take individuals if they can get to the RAC, then we will absolutely see them in a crisis situation. The RAC just won't take any emergencies. So we have a flow chart that actually we have it on a flyer that can be provided as well. So basically, if it's a substance use of an individual substance use disorder and that individual is willing to accept help, then the RAC can absolutely help them with the first steps to recovery. And if they're not willing, then, and it's another person within the community that is referring them to the RAC, then what can be done is provide that person with the information for the Rapid Access Clinic or our contact information so that they can seek help when they're ready. So with mental health challenges, so if the individual has symptoms that make daily life or self-care unmanageable, then call and speak to an engagement specialist or go to the RAC. If they do, and if the person is a danger to themselves or others, then seek immediate assistance or not a danger to themselves or others, seek immediate assistance at the RAC. If they are, then call the crisis line. So we have 6 more services to go, or no, 8 more. Anyway, we have 8 more services to go through. So here we have access points 5 through 8. So we do have recovery allies that do outreach. So it's really a proactive outreach within the community. We're engaging with the client or with potential clients, and it's what they're actually doing is building trust with those individuals. Not every individual who has a substance use disorder is ready to seek treatment, and if they aren't ready, then success may not happen, and in that case, that can be really discouraging. So we want to build trust so that person is going to come to us when they are ready. Individuals have the right to say no to treatment. Having a substance use disorder doesn't, or a mental health illness for that matter, doesn't disavow of your civil liberties. So they do have the right to say no to us, but we do continue to go out and engage with them because, again, it's building that bridge. We want to be the people they think of when they need help. The next one is the Clatsop County Jail. We have staff that work out of the jail. Those staff members build relationships with incarcerated adults to, again, establish trust and make it easier for them to be willing to engage in services. And those staff members, when the individual is released from jail, can do a warm handoff to outpatient services so that that client can then continue that care. Our shelter and housing is another access point. So clients staying in our shelter or supported housing are connected with services if they desire. And when we connect them, both staff on the housing team can walk with the client to build skills and address barriers, and then also seek that medical or behavioral health treatment and kind of help bridge any nervousness or dis-ease they might have with that process. Civil commitment.
Amanda,
yeah.
Commissioner Thompson has a question. Go ahead,
Yeah.
Commissioner.
Thank you, ma'am. As you can imagine, I get telephone calls from neighbors concerned about activities of other neighbors.
Mm-hmm.
There are certain, I would call them well-meaning people who say, oh, you don't have a place to stay, you have a substance use issue, come and put your RV at my house, or you can stay on my land, or that sort of thing. The person themselves may or may not see that there is a community alternative available. Code enforcement gets called, the police, the sheriff gets called. These are often rural situations. So I don't know if you have the bandwidth, the capacity to extend to situations in rural Clatsop County where there are issues and not altogether agreement on what to do to deal with those issues, but loose syringes rolling down the street, raw sewage dumped because there aren't really any sanitary. I mean, there are public health and safety issues. So I wonder, do you speak to those? Does all of this apply to that situation?
That would apply mostly to Recovery Ally outreach. They can go and outreach to those individuals, but not anything that I can think of that's specific. Can you think of anything, Shira?
I mean, this is just what Commissioner Thompson brings up is just such a complex issue, right? That behavioral health on its own cannot solve. Of course, we have like some shelter capacity, and we're building this beautiful building on Marine Drive called the Baker Building, which I think is going to have a really significant impact on our community. So we're doing all that we can. But again, to Amanda's point, if folks don't want to engage, we cannot force them to engage. You can't commit someone over a substance use disorder. So our hands, we can only do so much. And I think that that's a misconception in the community a lot. We have 8, I believe, 7 or 8 now recovery allies who are community-based folks, who are peers with lived experience, who are out there in the community all the time, pounding the pavement, having conversations with those who are houseless, and, seeing if they can find that window of opportunity where they're ready to engage in treatment so we can get them either to detox or to residential or to outpatient treatment. So we are out there, Commissioner Thompson, doing what we need to do to address exactly what you're speaking to. But the cost of housing, the availability of housing, right, the availability of treatment services outside of CBH are not things that we have, all that much control over. So.
Thank you. It is, as you point out, complex and difficult and expensive.
Yeah.
I appreciate hearing your response. I'll do my best to see if I can drum up support for you everywhere I go.
We appreciate that. We appreciate that a lot. I think affordability in this community is something that we just have to continue talking about, right? Like rental caps and more housing and those things, we need the resources to get folks off the streets.
Yeah. And out of the woods. Thank you.
That's right.
Yeah. So civil commitment, again, that will be gone over in another presentation. So I'm not going to spend time on that. So
I believe Monica had a question for you as well.
No, I was just going to add a clarifying on the one where it was talking about shelter. It says our shelter, but I know that CBH works closely with the other shelters, being Esperanza Village, Columbia Inn, Lifeboat Services. And so they have recovery allies that go into all of the shelters, not just CBH housing.
Right.
I know we're way over time too, Randy. So if you need to wrap us up, that's totally fine and understandable. But I know there were a lot of questions about how to get into services at CBH last time, so I wanted to make sure we got a good job addressing people's questions. So if you will allow us, we will continue.
Go ahead and continue. I think we're going to have enough time. So.
Okay, so the last 4 are school-based services. So we have clinicians stationed at Astoria High School, Seaside High School, Warrenton High School, and Napa High School. And those clinicians can see students without having to pull a student out of school and then deal with transportation time. And mom and dad don't have to take time off work necessarily, with exception of the family appointment. So that is another pathway. School counselors can refer students to, or the student themselves, if they're over at age 14, they can sign up for services if they want. So the next one is the emergency.
Hey, Amanda, sorry, I have a comment here.
Yeah.
What about Jewel?
So Jewel is now under Columbia County's purview. So Columbia County Mental Health will serve that school.
No, let me jump in.
Yeah.
Jewel has a school-based health center on site, and they contract their mental health services through a different provider. They're still in our area of responsibility. They have access to intensive in-home behavioral health, wraparound services. If folks in Jewel want to utilize CBH, we can do that, but we don't have a school-based provider in their school because they have a school-based health center.
Okay, good to know. Thanks.
So the emergency I'm sorry.
Sorry, Amanda, my hand's up.
Sorry.
That's okay. If I could just ask a question about the school-based real quick. I'm just wondering, how do you guys let the families know that there's a provider within the school? Or do you have the school counselors reach out to families at the school to let them know? Because I wasn't aware that you guys have someone at Seaside. So I'm just wondering, how do you let families know so the families know that that resource is there?
Right. So we do have that in our brochure. It is available on our website. And then also when people engage in services with the child and family team, they're given that option. If they're within that school district, they're given the option to see that clinician. So the emergency department. So in the emergency department, if there is a patient who may need recovery services and that the emergency department is aware of, then they can call our recovery allies. Our recovery allies respond to engage with that individual and try to get them in ongoing services. Then we have the deflection program. So this is the newest program. This is multi-agency. We work closely with law enforcement on this. The purpose of deflection is to get people into recovery, and by doing that, they are able to the charges that they would have had when engaging with law enforcement are then dropped. Removed from their record. So, or actually they're not even put on their record. They're just on hold until that person completes the deflection program. It's a 90-day program. And the individual has 72 hours to engage with us. And that program is only by law enforcement referral. So they have to have a citation from law enforcement to be part of the program. And then the last one is treatment court. There are 3 programs that are treatment court within Clatsop County. We have drug court, family court, and mental health treatment court. And we participate in that. We have staff members that work in that program. And they, along with judges, attorneys, court clerks, etc., work with the client to get the help that they need and avoid jail time or more jail time in some situations. So that is all of the access points for individuals.
Randy, if I may, real quick, and I know because Christina is going to present and she has to go to another meeting at 4, but I do just want to add, and we've talked about it before, so we have increased the pathways through deflection, so law enforcement isn't the only option to refer. There are a couple of additional ones, and that's simply so that way we can make sure that we're trying to get as many people who need the help that they need. So I just wanted to kind of clarify that too. You're muted, Randy.
Sorry. Amanda, can you share this presentation with Lisa so she can send it out to the members in the group?
Absolutely.
Yeah, that'd be great. Thanks. Any questions or comments for Amanda before we move on? If not, we're good. Okay. Thanks, Amanda. Appreciate it.
Yeah, no problem.
Okay. Let's move on to Christina Schultz from the Clatsop County Sheriff's office, and she's going to present on the new TrueNarc that the county sheriff has, I think we're the first one in the country to get, or the state anyway. Christina, are you there?
Yeah. I am. Thank you. I do realize that my camera has not been fixed by IT again, so it may cut out. So I'll try and get on first. But yes, my name is Christina Schultz. I am the deflection program coordinator with Clatsop County Sheriff's Office. With our grant, we purchased, and of course, there goes my camera. We purchased 2 of the thermo handheld narcotics analyzer. And what it is a small portable drug analyzer that has a laser that can potentially go through pretty much anything that the drugs are contained in. We just have to be careful of what the color of the substance is that we're shooting the laser through. But the nice thing is it detects. I'm going to see if my camera will work again. Okay, so this is what the analyzer looks like. It's very small, very portable, and we have 2 of these. These are stationed at Clatsop County Sheriff's Office and one at Seaside. So all agencies within the county can respond to either of the locations of the handheld and the drugs tested right then and there. The reason we went with these, this is a lot safer method of testing drugs because of the fact that we're not asking the officers to open up the containers of drugs that they're encountering just due to the fact of the fentanyl exposure that we have nowadays. It's easier that they can literally shoot the laser right through the container itself, whether it's a plastic bag, whether it's a container, whether it's liquid. We can test all different forms, and it literally gives us an immediate readout of exactly what the drug is. The nice thing about this analyzer is it has a library of over 800 drugs, synthetics, any component that makes up drugs. So it kind of gives us an analysis of what it is. And then we're constantly building that library because, as we know, there's always new drugs that are being introduced into the. And so we want to have that where we're constantly building that library. The nice thing about this TrueNarc is the fact that when we do test the drugs, if we do get a substance that we are not familiar with, we will be sharing that information with public health. We'll be sharing it with CBH and with emergency rooms so we can know how and to handle the drugs that are coming into our county. Knock on wood, we haven't had anything that isn't out of the ordinary that we've seen. But the majority of the drugs that we're testing right now, we've had probably over 110 drugs that have been scanned. And a lot of this is, folks that are going into the deflection program, but any of the officers, troopers, and deputies can utilize this machine and, utilize it for their cases and put it with the report. Because I know that DA Brown is wanting all drugs tested by the TrueNarc because of the fact that it is right here and we have the analysis right at hand versus sending the drugs off to the crime lab, which takes 4 to 6 months to get the results back. So this has helped speeding up the technology of what we have on in the streets. That we're honestly seeing in the Clatsop County right now is obviously fentanyl, methamphetamine, cocaine. We've had some MDMA, we've had cocaine, but then we've also got the cutting agents that we're starting to see a lot of too. So nothing that, we've seen baking soda, lactose, milk, dairy products, just all these different things that are being utilized to cut. And I know that there are several other counties that are now starting to getting at TrueNarc just because of the fact that it's so quick, it's so portable, it's so handy, and we're really wanting to keep our officers safe. And so, yeah, I'm just sitting here compiling data daily, when we utilize it just to see what we have going on. Is there any?
Yeah, Monica has a question.
Yeah. Thanks, Randy. Christina, can you just kind of elaborate on how it's also helpful because even though the intent is known that somebody might be trying to buy and use drugs, especially in the instance where we're citing them, how this tool helps, because we can't convict somebody if it isn't actually drugs.
Yes, Monica, that is correct. We want to make sure that what the folks have in their possession is actually drugs. We want to make sure, because a lot of times, we've been told, oh yeah, this is what I've got. I've got methamphetamine. Well, no, it's actually this. We had one of our clients in the deflection. It's like, yeah, this is methamphetamine. No, it actually tested for M. And so we need to know exactly what substance we are dealing with, because not all the testing kits that we carry in the patrol cars carry all the broad spectrum of what drugs are out there. So this machine that has the capability of a library of over, I know it's over 500, we might be up to 800 now of, different types and strains that we have out in the, the county, in the world right now. So does that answer your question, Monica?
I was speaking a little bit more to what happens in regards to a case, because there are instances where it might be a baggie full of baby formula. And so as far as us trying to convict somebody, even though we know what the intent was, unfortunately, if it turns out that it wasn't actually drugs, we have to just release the person and drop the citation.
That is correct. So if the officer test the drugs right there on the street or at the station, and it comes back inconclusive, or it does not come back as a drug, then yeah, they cannot, write a citation for that. They can't arrest them for that. We can obviously write the report up and send it to the DA's office, but at the charging, no, we cannot move forward with that. Jill, it looks like you have a question.
Yep.
Yeah, I'm curious. So you have a catalog of 800 plus. So with all these new synthetics that are constantly coming out that we're trying to keep up on, is there a way that, like, I don't know, I guess I'm just asking, like, does this catch those, all the new stuff, or does that take some time for it to catch up?
So the trick, they do 2 normally library updates a year and updating. There is a new TrueNarc machine that just was released that is a little bit faster with and a bigger broad of the library that it accesses. TrueNarc does update their library twice a year that we are literally scanning the drugs against. And so that's where we're getting the results.
Well, thank you. Totally fascinating.
It is a very fascinating tool, and just being a previous law enforcement officer, this is way safer, and that's what we want, is the officers to go home safe at night and not have an exposure to a substance.
I take it the initial responses back from the officers, law enforcement, is positive and they're liking it.
Yes, they are liking it. It's just so quick and it's so easy. And yeah, just the results are instantaneous versus having to send it off to a crime lab and waiting 4 to 6 months to get that official documentation that it's on site.
Yeah, nice. And then Clatsop County is, from my understanding, the first county in the state to get this.
I believe we were the first ones to get it. Yes, I believe now Polk County has it. And I know Washington County and Tillamook is also looking at it. So they've reached out and asked, and I've given them all kinds of data and information about it. So we're trying to let other agencies know that this is an amazing tool to have. It is expensive, but it's well worth the money.
Sure.
And
nice.
I'll just add to, Christina mentioned, that we share the information with agencies such as CBH and law enforcement, so that way, and public health, so that way they kind of know what types of drugs are out on the street. And that's also helpful information for those agencies, because in some instances, some of the drugs that are being used, things such as Narcan, aren't going to work. And so helping people understand when they're using some of these substances, you can have a whole bunch of Narcan, but it's not going to help you in this particular instance. And so just be aware of, what you and your friends are using and the risks that you're taking.
And the nice thing is that we can take these out, because unfortunately significant amount of overdose in Clatsop County. And so we can also take this out to the scenes of an overdose and we can test the drugs right there on the scene. I know our deputy medical examiner does have a fancy quick machine that can even do more than what our analyzer can do. But right there at the scene, we can start testing some of the drugs just to know what type of a death that we might be dealing with. And then she will then extract some of the, fluids to test even more and make sure that everything is, what it says it is.
Okay, Jill has another question.
Yes, Jill.
I think Commissioner Thompson had her hand up first.
Okay.
Oh, sorry, I didn't see Commissioner
That's
Thompson.
okay.
Thompson.
Thank you. Well, what an interesting concept. So if you can type into the chat the actual name of the machine and the cost of it, that'd be great. But the second part is, we have programs to have safe needles in use. Is it conceivable that we have programs that make use of this technology to give feedback to substance abusers what exactly they're looking to buy and partake of? Now, isn't that just a swamp to head into? But a logical person thinks about how to protect public health. And to what extent are we allowing or promoting substance abuse if we provide accurate consumer information? I don't have the answer, but your presentation and the way deflection can work made me wonder if we could basically save lives by providing that kind of consumer information.
We're definitely letting the folks know. I meant when we're testing the drugs, we will let them know what the drugs came back as. Because we are getting some shocked reactions because they were told that they were purchasing, X, and all of a sudden now it was not what they were purchasing. So again, they need to know what they're purchasing and hopefully not buy from that dealer again, and hopefully, the deflection program and get them on a pathway to getting them the help that they need to get clean and open their eyes to that. A lot of drugs out in this county and in the world are being laced with multiple things now. So unless you're buying, your marijuana at a dispensary, you have no clue what you're purchasing on that street. And you do not know what is being cut with. And I think that's why we've seen a lot of overdose deaths, is because some of the drugs that they're taking are laced with other things.
Okay,
Thank
Jill?
you for a great question.
Yeah, and my comment just kind of supports both Christina and Commissioner Thompson's comments, and that with public health getting the information, this really, Lisa Schuyler is our regional overdose prevention coordinator. And so she works not only with our regional overdose partners, but also with our state overdose partners. And so the information that public health is able to get with surveillance, we can message that out to our local community, our regional partners, which we, to the extent that we can right now, we're already doing that. If Tillamook's seen this spike in overdoses, we are already connecting with them about that. And then that's being funneled into the state overdose response plan. So they're letting us know, even if it's in, Jefferson County, they're letting us know where this is happening, because if we, it is that awareness that Commissioner Thompson was talking about. And we are working on a communications plan that public health can enhance our efforts around that surveillance and sharing that information out to the community. And so we're having the TrueNarc is just going to really help us be able to do that.
I totally agree. Shira, you have a question.
Yeah, I just wanted to add that, that there was a time when fentanyl was new to our communities, that like fentanyl test strips and things like that. We wanted to get in the hands of folks who were using drugs to help them was the drugs that they were taking, to hopefully not take something with fentanyl in it due to the lethality of the substance. Because fentanyl's been around for so long now, it's actually really, really tough to get a hold of heroin. Most folks are dependent on this drug to the point that they're seeking out the most potent forms of fentanyl. So I just wanted to add a framework, right? That like sharing this information with folks who are using drugs may not so much be a prevention strategy as it's more helpful for public health folks and medical responders to know what is in the community in the event that folks are overdosing. And then medical folks know this is insect repellent that has been added to this drug. And now I know why they're having these strange reactions, right? And so what I know of folks who use in this climate right now, they're not being deterred from substances because they know what's in the substance. In some cases, it increases the likelihood that they will go back to a certain dealer.
Yeah, but no, I'm very happy that we have the speed and the technology with this new handheld analyzer, and the fact that we can share this information a lot quicker than versus waiting, 4 to 6 months to wait for it to get back from the crime lab. So it is speeding up, letting the community know what we have in, so we can address that immediately and know how we can treat these folks.
Yeah, and I can also see where this could probably create some instances of violence with the users finding out this is not what they purchased from their drug dealers and going back to their drug dealers and confronting them. And and so it's very fascinating. So
thank you.
Thank you for presenting. Yeah, any questions or comments for Christina? All right, Christina, thank you so much. That was really interesting. So thanks.
Thanks for having me. And if you need any more information, I'm always available. Thank you.
All right. Thank you.
Great day. Bye-bye.
Okay, let's move on for discussion and Sharps container disposal. So I had Lisa add this to the agenda. Lisa and myself and some others were in the past month chatting at another organization at DD Services about Sharp container disposals, and there has been some conflicting reports on how to get rid of the Sharps containers for people who has diabetes that use them on a regular basis. And a lot of the pharmacies, or all the pharmacies, I think now in this county, don't accept them anymore. Doctors don't accept them. Hospitals don't accept them. At one point, Recology was accepting them, but then a friend of mine called them and they said, yes, they do accept them. But then she went down to the Astoria transfer station and they told her, no, we don't accept them. So Lisa and Monica looked into this a little further, and so did I, and it comes up that Recology does accept Sharp containers either at the main office in Warrenton or at the transfer station in Astoria at a price. So I just thought this was, it looked to be for a while that it was a health crisis with people that has a lot of Sharps containers laying around, and what do they do with them? They don't want to throw them in the trash, obviously. And I know that the needle exchange programs they take the Sharps containers at their location in Seaside and Astoria when they do that once a month. Is it, Lisa, or once a week? Once a week. Once a week.
Location.
Yeah. So I just wanted to get this out. And Lisa and Monica thought this was a good idea to get it out to where people are knowing this, because a lot of people do not know this. So if people want to share that with that bit of information with others, that would be helpful. And so that's all I have on that. Anybody, Monica, Lisa, anybody else have any comments?
Yeah, just
Seamus.
Go ahead, Monica.
I was just going to say Seamus has a question, and then
Seamus, okay. Go ahead,
I'm
Seamus.
curious, do we know what the prices are?
Yes, we do. It's
I have it pulled up if you-
Lisa and Monica can pull them up. They shared the prices with me. They can probably pull it up quicker than I can.
Yeah, I have
Thank
it
you.
pulled up, Lisa, if you want me to go ahead and do that. So if you go to the Warrenton office of Recology, which is out by the airport, depending on the size container that you have, it would be $23.20 to $51.90 to turn that in. If you take it to the transfer station, it's just a little bit cheaper, the transfer station being in Astoria, and that's $22.30 to $50.47. Again, depending on the size, whether it's a 4.7 quart container, a 10 quart container, or a 23 quart container. You can also contact, and we don't have the prices for this because it kind of depends on whether you are considered suburban or rural residential. But you can also have this kind of like your garbage service, and they can come to your home and pick this up as well. And then I can't speak for certain, it's something that you would need to check. But if you do have like an HSA or an FSA, oftentimes those will cover Sharps containers. I can't guarantee in regards to the disposal amount. So again, you would want to confirm with your HSA or FSA program whether or not that cost would be covered through those. And I don't know, Lisa, if you have anything else to add, or if you had any other questions, Seamus?
No, that's good. Thank you.
I'll let Commissioner Thompson.
Commissioner Thompson has a question.
This is such empowering information. It's so important. I want to see if we at Clatsop County can put a hot link on our homepage so that anybody who has a question, really virtually everything we've discussed today can be life-saving information, can make that difference in somebody's survival and their well-being. Well, can we make it easy for people to get this? That's a county administrative decision. I mean, I can wend my way through the county's website, and it's better than it used to be, but a hot link so people can get all of this, that pamphlet, this information about disposal, the information about the TruNarc, all of this. I just want to see it right up close front and personally accessible to people. That's my pitch to Clatsop County staff.
Well, Commissioner Thompson, that's funny because I had originally requested to put this on the agenda because I was going to actually confront you and bring this to your knowledge, and that we at first it was my understanding there was no place to drop them off except for the Neal Exchange program, and no other. I know Recology had told me that they didn't take it. They told a friend that they did, and then they didn't take it. And so I was going to actually bring this to your attention to see if the commissioners can do something about this. And because it is a crisis in the making, or that I thought was going to be, something that needed to be addressed countywide. And so
let me just give you a more accurate image of the control I have over staff operations. Clatsop County Commissioners, I'm one of 5. Clatsop County Commissioners don't directly control what staff does or doesn't do. We set priorities. We monitor the county manager and what happens in the county, provide feedback. We can bring in good ideas. We can't say to somebody, and you will do this tomorrow.
Right. No, I understand that, but I was going to bring it to your attention to provide feedback to your fellow council members, your commissioners. So anyway.
And staff hear you, and we will work with our communications team to get the information out so that way people are aware of these services that are still available.
Great. Awesome. Thank you. Okay, no other questions?
I also wanted to just clarify, sorry, that the harm reduction services. The funding for that program is specifically to do needle exchange for people who use drugs, injection drugs. And so while we wouldn't turn someone away if they were confused by the messaging of who it is that we do needle exchange for, we would accept their sharps container if they came. It couldn't be like that couldn't be the answer to how they're getting rid of their sharps. And I know in the past, for a very short period of time, we had our household hazardous waste facility able to accept those, but then the contractor changed of who we were dealing with, and the new contractor was not able to accept those. So it is like a gap that at least I've been aware of for quite a few years. And knowing that the pharmacies and the hospitals don't accept them, and that our program is focused on just a small slice of people who need to dispose of sharps in the community.
Yeah. Lisa, those prices that we were talking about, can you send those prices out to the council here so everybody has that information?
Yeah, I'll add it to the notes for sure. Yeah.
Okay, perfect. Thank you. All right, let's move on. Member renewal, Grant North. So Grant's term expired in February, and that slipped through the cracks, but we caught it. Lisa caught it. So I've spoken with Grant, Lisa, and he has filled out an application. I think he sent it back to me here just right before we started our meeting. And he wants to continue, but I'll let Grant speak to that. Grant, you're up.
Yeah, I would like to continue. I think I've learned a lot. I'm hoping that I've been a little bit helpful, but it's been a great experience for me anyway. And I think that's definitely some things that we need to continue in the county. As you can see from today's meeting alone, there's just a ton of interesting things, A, going on, and B, things that we're doing to help people. So yeah, I'm more than happy to continue.
Okay. There you have it. So thanks, Grant. We'll get your application sorted through, and I'm sure everything will be fine. And then Lisa, you'll present that with the board chair and board vice, or council chair and council vice president, to the board of commissioners, the approval.
I'll route the agenda item, and we'll figure out whether you, or I think Monica in the past has presented as well, whoever, or yeah. I'm fine with doing it too, whichever person we think would be best to be the presenter on that.
Sure. All right, cool, thanks. Okay,
you guys need to vote on it first, Randy, for it to go to the board or not?
Well,
do you need to make an official motion?
I got to look at the application, and I got to talk to Grant officially, because I'm the person that does the interviews with the potential applicants. So you tell me, Monica, should we go through that process, or let's just.
Well, and I hate to be the buzzkill, and I'm excited that Grant wants to continue because he's had some great feedback and everything. But we do have to open up the process, and so we can't just automatically appoint him. We do have to see if there are other applicants who want to apply, and so we should advertise it and open it. And Grant would submit his application, and so I think that it's something that could be relatively quick, and then we could have it go. Your committee's recommendation would then go before the board in the month of July.
So, okay, Monica, refresh my memory here. So in the past, when one of our memberships or multiple memberships were coming up for renewal, I don't remember going through that process to where we opened it up, the county opened it up for applying for anyone.
Typically we have, because again, if somebody's term is expired, then we have to go through the public process to notice the vacancy, and then let other people apply. Somebody else might not apply, but we do have to open it up through the public process to notice it.
Has expired or will expire?
Well, either way, like, you can't appoint him prior to him expiring. Like if there's a term that's expiring or has expired, then we have to notice it.
Okay. All right.
Yeah.
Point taken. All right.
Yeah.
So Grant, hang tight. Well,
But
we'll
but
get your
but to
application
that
in and
point,
we'll open it up.
but to that point, you know, we can quickly get this notice. Grant can submit his application. We can keep the process going along, so that way we're not, you know, dragging it out.
Right.
And Grant, do you have the link to submit your application?
He does.
Yeah, I submitted it this afternoon, so.
Okay, perfect. Thank you.
He sent it back to me here recently, so I'll get it back off to you.
Perfect.
Yep. Okay.
I submitted it through the county too.
Oh, you did? Oh, perfect.
Yeah.
Better yet. Okay. All right. Let's move on to provider reports. CBH, my understanding was Shira wasn't going to be here for this meeting, so I thought Amanda was going to present in her place. But Shira, do you want to present?
Off the hook since Amanda presented already. I don't have a ton of updates for you all other than, you know, we're cooking with gas on the Baker building and have a plan to open in December. And still continue to work with the school districts on getting some substance use disorder treatment available in the schools for young people. And we're excited about that program expansion. And like Amanda said, we're set to open drop-in services at our Seaside Clinic for mental health walk-ins in August.
Okay. Any questions or comments for Shira? Okay, let's move on then. Thanks, Shira. I got to say, the Baker building, they're making good progress on it. I drive by it once in a while, so looking good. Reports, Commissioner report, Commissioner Thompson. You're up.
Well,
Got
here's,
any?
you know, I go to AOC meetings as often as they're held. We have a Health and Human Services Committee meeting, and that's directly related to the things that are happening here. There's a Public Safety Policy Committee meeting. That's related to what we're doing here. There's also every month a Local Government Advisory Committee meeting where the heads of the Department of Human Services and the Oregon Health Authority sit with county commissioners and other service providers in a room and talk about what things are going on in counties, in cities. And it's a direct conduit. It's direct feedback from what we're doing to what they're regulating and administering. If you give me information that helps link the agendas in those committee meetings with what's going on in Clatsop County, it's a perfect opportunity to share information. I really love the idea that in our sharing of information, we improve efficiency and effectiveness, we save lives, you know, we make the world a better place. So to the extent that you can use the meetings that I'm in, all of the other people who are in those meetings and what we need them to know, there's an opportunity. So let's just keep discussing that as we go forward.
Okay. Any comments or questions for Commissioner Thompson? All right, let's move on to County Management Report and Monica.
Jump in here real quick before Monica goes.
Oh, sorry.
Go ahead.
I just have to run and I apologize. But I also just wanted to invite like more requests from this group for presentations on anything that we do here at CBH. I think it was actually really helpful last month when there was some concern brought up about access to the organization, because it gave me an opportunity to think about how to communicate what access means at CBH and all of the different access points. So if you're like, I don't understand what kid services entail, or I don't understand, you know, we are going to cover the commitment criteria and process here in an upcoming meeting. But just if there's anything that you want more information on, please feel free to let me know that, because I think using this space for information sharing feels really valuable.
Yes, it is. and with DD Services as well. So,
Absolutely.
okay, Monica.
Thanks, Shira. Thanks, Randy. And I don't have a whole lot to add, but I was just going to kind of build on what Shira was saying regarding upcoming topics. And so, as she mentioned earlier, and Amanda kind of mentioned as well, one of our next presentations is going to be on aid and assist, because I think it is helpful for folks to understand, you know, while we want to get those individuals who have substance use disorder or mental health struggles, that we want to get them the help, but they also have their civil liberties. And so what some of those limitations are when trying to get them the help that they need are. So that's going to be, I believe, and Lisa can correct me if I'm wrong, that's going to be one of our next presentations, is the aid and assist component. And I think that that also goes to the question, and I'm sorry if I'm jumping ahead, but determining when that next meeting is going to be for that aid and assist presentation.
Okay. And that's it?
Mm-hmm. Yep.
Okay. Thank you, Monica. Any questions or comments for Monica? All right, let's move on to public health report and Jill. Miranda Robinson has a question here. Let me.
Oh, sure. I put my hand down and put it in the chat. I was just going to say it would be helpful to figure out what provider referrals look like for CBH. Who does CBH identify as a provider, and how do we or other providers make those referrals?
Shira?
Are you able to? Shira had to jump off, but and I know that when Amanda was presenting, she kind of went, she mentioned it at the beginning, but kind of like, and that's a separate route. And so we can just make a note as one of those presentations being the provider referral process.
That would be great.
Perfect. Thanks.
Yeah. Thanks, Miranda. Okay. Let's move on to Jill.
Yeah, I can just do a quick update because I think most of ours will probably come from Lisa. But last week I did attend the listening session. The Alcohol and Drug Policy Commission was in Seaside. They're an independent department, I guess, of the state doing listening session. And they had us all in groups from recovery, treatment, harm reduction, and prevention. And I think there was some really good discussion with some really passionate local folks at that. And I think that I think they're still soliciting virtual feedback through the end of the month, if I remember right. And Lisa, I can get you, I think you had already asked for the link to that. If they're still soliciting that, I can get that out for this group. And then on Wednesday, Lisa and I presented the close to final draft of our health equity plan to the county commissioners with positive feedback. And I just wanted to thank this group too for their input and feedback into that plan. And we are on schedule to have that deliverable submitted to Oregon Health Authority. And so once it's all approved by the powers that be, we're excited to bring that back to this group and share with you what our focuses will be for the next 5 years. And I'll pass it to whatever's next on your agenda.
Any questions for Jill? Questions or comments? If not, we'll move it on to Lisa.
So I'll talk about harm reduction first. We're coordinating more with peers from other organizations too, who are important for harm reduction. And then we're also potentially having a couple of volunteers who have experience and are registered nurses who want to help with the harm reduction program as well. So that's exciting. And then when we're talking about drug testing, we do give out fentanyl test strips when we have them at harm reduction. That was one of my questions, kind of like what Shira was talking to when I started overseeing the program, which was, is it relevant still because it's so pervasive for fentanyl to be in drug sources? And the harm reduction coordinator and other staff working in that program said that it was still relevant for conversation with folks who did not think that fentanyl was in the drug that they were taking. So they did not think that they needed Narcan, or it was something, or an opioid overdose was something they needed to be looking out for. So we do still give that out. I know there are other harm reduction programs that do have like drug testing equipment as part of something that they offer, but that's not something we do in ours. And then also for our youth prevention needs assessment, we've completed all of our focus groups at this point. We have our survey, which is going to be open until probably the end of this month, that we're getting feedback from school staff on. And then after that, it's going to be analyzing we have a few more key informant interviews too, but then it's going to just be analyzing all of that information. And we hope to have a report that we will definitely share with you all around October, after we've looked at all of the information we gathered and other data sources on Clatsop County youth to do with substance use. Commissioner Thompson?
Well, please send that to the County Board of Commissioners as well. It's such a critically important area for us to concern ourselves with. I just want to keep that flow going. Thank you.
Yeah, absolutely. And then for our problem gambling prevention program, Stephanie, who's our new health promotion specialist, she started in April, I think. She has been working through the training for QPR, which is Question, Persuade, Refer, which is a suicide prevention training. And then once she's trained in that, we'll be back up and running with being able to give QPR trainings as a gatekeeper training for suicide prevention to community groups. And our other positive youth development health promotion specialist has been going out and doing a lot of vaping prevention education through a evidence-based program for youth at the different school districts. And she's also going to be taking the QPR training, specifically one that's focused on youth soon. Jill? Looks like Jill. Go ahead.
Yeah. I wanted to also respond to Commissioner Thompson, is that I already have spoken with Teresa, and we're on the agenda planner for this fall. So it will definitely be coming to the commission before it goes out to the public. But we have been asked, we've been asked by the CCO to present on that at their conference this fall. And some other folks are really interested in that work as well.
Thank you, Joe. And that was it for me.
Okay, thanks, Lisa. Questions or comments for Lisa? If not, we shall move on. And we talked about skipping our July meeting because it falls on the third day before the 4th of July, and people aren't going to be here. So our next meeting is going to be August 7th, if that's all right with everyone. For the council members, does that work out for you if we skip July 3rd and go straight into August 7th instead? I see Miranda's looking or taking notes anyway, or something. Anyway, okay, so it looks like, sounds like that's going to be okay. So our next meeting will be August 7th at 3 p.m. And our proposed topics, Lisa, do you want to expand on that?
I think it was the aid and assist that you were just saying. I have it down as civil commitment process. Is that the same thing, Monica? Okay.
Well,
Perfect.
I mean, it's two different things, but we can cover it in the same like presentation.
Perfect.
Okay. Thank you. I'm adding it as a second topic.
Great. All right.
It's gonna involve both the sheriff and CBH, Lisa.
Perfect. Wow, great meeting. A lot of good info on this meeting. Very informative. So thank everyone. So good of the order, anybody? Once again, Commissioner Thompson, I just want to thank you for being involved and bringing back the Board of Commissioners to our meetings, because it's been a long time since someone's been this involved. So again, I appreciate you. Thank you. And that's it. We'll adjourn. It is 4:20, and we'll see you all in August. And good seeing you all today. Thanks.